Polycystic ovary syndrome. Your lecturer is Assistant of the Department Yegijanova Gulbashan Mirzahmetovna. Polycystic ovary syndrome is a clinical syndrome characterized by moderate obesity, irregular menstruation or amenorrhea, and signs of an excess of androgens, for example, hirsutism, acne. Most patients have multiple ovarian cysts. The diagnosis is made based on the results of a pregnancy test, measurement of hormone levels, and visual examination methods to exclude viralizing tumors. The treatment is symptomatic. PCOS is usually defined as a clinical syndrome, regardless of cystic changes in the ovaries, but the presence in the ovary of a multitude of 2-6 mm or large follicular cysts containing atretic cells is typical. The ovaries can be of normal size or enlarged and have thickened and smoothed protein coat. The syndrome is manifested by anovulation or ovulatory dysfunction and excess of androgens of unknown etiology. However, there is some evidence that patients have a change in cytochrome P450 C17 that damages 17-hydroxylase, an enzyme that restricts androgen production, resulting in an increase in androgen production. Polycystic ovary syndrome has several serious complications. Estrogen levels are elevated, which increases the risk of endometrial hyperplasia and, as a result, endometrial cancer. Androgen levels are often elevated, which increases the risk of metabolic syndrome and is a cause of hirsutism. The possible presence of hyperinsulinemia due to insulin resistance may contribute to an increase in androgen production by the ovaries. Prolonged hyperandrogenism increases the risk of cardiovascular disease, including hypertension and hyperlipidemia. The risk of an increase in androgen levels and related complications can be as high in women who are not overweight as those who have it. Symptoms of polycystic ovary syndrome usually appear during puberty and increase over time. Common are premature androgens characterized by an excess of dihydroepiandrosterone sulfate DHEACS, often early axillary hair growth, body odor, and microcomedone acne. Typical symptoms include mild obesity, mild hirsutism, irregular menstruation, or amenorrhea. However, about half of women with PCOS are of normal weight, and some women are underweight. Body hair can be of a male type, for example, on the upper lip, chin, back, thumbs, and toes, around the nipples, and along the white line in the lower abdomen. Some women have other signs of virilization, such as acne and temporary thinning of hair. Other symptoms may include weight gain, sometimes seemingly difficult to control, fatigue, lack of energy, sleep problems, including sleep apnea, mood swings, depression, anxiety, and headaches. Some women have impaired fertility. Symptoms are different in different women. Signs of thickened and darkened skin, black acanthosis, can appear in the armpits, occipital neck, folds of the skin in the finger and or elbow bands. The reason is a high level of insulin due to insulin resistance. If women with PCOS become pregnant, the risk of pregnancy complications increases, and these complications are usually more severe if women are obese. These complications include diabetes, mellitus in pregnant women, preterm birth, and preeclampsia. Clinical criteria: serum levels of testosterone, follicle-stimulating hormone, prolactin, and thyroid-stimulating hormone, pelvic ultrasound. Ovulatory dysfunction usually occurs during puberty, leading to primary amenorrhea. Thus, this syndrome is unlikely in cases where regular menstruation has been observed for some time after the menarche. On examination, evident cervical mucus is usually found reflecting a high level of estrogen. PCOS should be suspected if a woman has two typical symptoms. The examination includes a pregnancy test, a blood test of levels of total testosterone, FSH, prolactin, and TSH, pelvic ultrasound to rule out other possible causes of symptoms. Examination of serum levels of free testosterone is more sensitive than determining total testosterone, but it is technically more difficult to measure. Male hypogonadism, diagnosis of primary and secondary hypogonadism. Normal or slightly elevated testosterone levels and normal or slightly elevated levels of FSH suggests the presence of PCOS. A diagnosis requires at least 2 of 3 criteria below: ovulatory dysfunction causing irregular periods, clinically and laboratory proven hypergonadism, more than 10 follicles in each ovary, detected by ultrasound of the pelvic cavity, usually located on the periphery and resembling a string of pearls. In women with this criteria, serum cortisol levels are measured to rule out Cushing syndromes, and early morning 17-hydroprogesterone levels are measured to rule out adrenal virilization. The serum level of DHEAS is measured. If the level of DHEAS is not normal, the woman examined in the same way as with amenorrhea. Adult women with PCOS are examined for metabolic syndrome by measuring blood pressure and serum glucose and lipid profile. Thank you.